Well, and welcome to this part 2 of our AO annual preview. I'm Wes, the dental guy.
And I'm John, the dental guy, and we are excited to be back with you one night after another, talking about what is sure to be one of the most exciting events in the implant world this year. And we are, just about as excited as anybody, Wes. We have again been waiting for this meeting to be back in person for a couple of years, and really for meetings in general to be back to being in person. And I think all clinicians, researchers, everybody is ready to get back to collaboration, to get back to talking to each other about what's important. And, whether it's seeing the best speakers or whether it's just hanging out over a coffee or a cocktail and discussing what's going on in your practice in your life. And if you tuned in last night, the dental guys are going to be in San Diego. Tomorrow, Wes, right? Here we go.
Yeah,
it's going to be a travel day, and we're going to be rolling.
It's Tuesday night, and we're excited. Travel day tomorrow. The Dental Guys podcast is going to be covering the Academy of Osseointegration annual meeting in San Diego this week. You can tune in live, right? Starting, I believe, on Thursday at noon, John. We are going to kick off the day and with interviews, talking to some of the highest level clinicians and researchers in the field of implant dentistry. And what I will say is keep your hand on that, right, on that phone. If you're not able to attend, subscribe on YouTube. You can go over to the Academy of Osseointegration YouTube page. You can subscribe there. Another place to get it is on Facebook, if you're on Facebook there. Follow us on Twitter, too. And you can check out the dental guys at all their outlets, right? We're going to be on there. We've got our own little social media crew traveling with us this time. And so it's going to be fantastic. John, one of the things you mentioned there early in the intro was a time to get together afterwards, sit down, right? Socialize, collaborate, just have a good time. One of the things that I remember my first experience with the Academy was the big reception that they spin off at this meeting in the evening. And Friday night, right, we're going to have a very special meeting after the meeting, right? It's going to be on the USS Midway. And
this is big,
Top Gun, here we go,
Right, I know. You have to understand that Wes and I are of the vintage where Top Gun means something.
Vintage.
And yeah, it is. Now we're at that point. We can be the older guys now. That's just part of it. But we know what the need for speed is. We know who Maverick and Goose are. We know that Miramar is where fighter weapons school / Top Gun happens. And so when you're in San Diego and you are among some of these unbelievable, pieces of history, you feel this kind of cool connection, with the country. And it sort of symbolizes a little bit of sort of things maybe coming back, in a sense of being able to finally be free to get out and have a conversation, collaborate, discuss, be in a group. We're all sick and tired of sitting alone on Zoom. Not that Zoom's all bad. We understand that. Here we are on a video, live stream. It has its place. But what we're excited about is getting to connect with people. Now, if you can't make it to the meeting, as Wes said, and you can't get to the reception on the Midway, we're going to bring you some stuff. Now, the Midway, we may not have interviews on the Midway because you can imagine that's not going to be easy, but we'll get some good pictures and we will tell you a little bit about it. We'll give you some highlights. One of the cool things AO is doing this year, in order to connect you, the listener and the clinician, to the speakers and researchers represented, is they're going to have a hashtag AO Dental Guys 22 that you can submit your thoughts and questions to that may actually turn into something that we, the dental guys, ask the speakers that we interview. So not only do we have these cool social events where we get to maybe, rope people in to getting to talk to us that maybe we haven't, but it's also an opportunity during that time to connect with people who say, hey, I saw your interview earlier today. Who are you talking to tomorrow? Here's a burning question. Well, if you're not there at the meeting, give us your burning questions to that hashtag. And you never know if your stuff will show up in our interviews. So
that would be
we've got
super cool, right? If you got picked, your question got picked to be on the show. You know, one of the other things that is going on is this Young Clinicians reception, John, and I hear that it is just amazing. We're super excited to go to that. We're going to be doing some man on the street interviews. We're going to be taking a camera, walking around, and we're going to be producing some content and interviewing some people, just one-offs, man. It could be anything from, you know, young clinicians, young budding researchers, to people that are just at the meeting. Also, we're going to be going around the show floor, John. I mean, how about this? This is the opportunity, or, you know, where, you know, new products might be highlighted. People might be bringing things that maybe are introduced. We know that Wednesday morning has been typically reserved, right, John? Thursday morning.
Thursday morning for the corporate.
Yeah, it's been reserved for the corporate forum, where the AO allows corporations to come in and they bring in their speakers, their researchers, typically people that you might know about, and they present product and research behind that product. Well, a lot of times what John and I like to do is ask the hard questions, and we go to the booths and we find the people and we ask the tough questions. And one of the ways you can get your questions asked, if you have questions about product, maybe you just tweet us over there at AO Dental Guys 22, and man, I'm ready to bring it, John. You ready?
Well, I mean, this is the thing, you know, and we mentioned this yesterday. Stagnation has been a problem in the last couple of years. COVID kind of, you know, had a lot of us sort of just go inward, just sort of put our head down and go forward. Well, companies maybe did some of that, but now they are in full speed ahead. If you've looked at the economy anytime recently, you will see that patients are ready to move forward with some cool things. And we're doing some neat treatment in our practices, and the companies are stepping up to provide new and exciting products. But it all comes down to, and if you've seen our AO recaps from years past, you will know that we don't just go in and say, hey, tell us the marketing. We want to know the data. We want to know the research. Yeah. That's what AO is all about. And in general, these companies bring their top minds to the booth even for discussion. They know they're going to be getting the high level questions. They know it's not enough just to say this person uses it, so you should too. They're going to actually have some data. So we're going to be able to do that. We also have on the interview schedule some high level lab
let's
technicians.
Talk a little bit about that, John. Let's give a little bit of like a preview of some of the things and some of the people we're going to be talking about. How about a point counterpoint, right? On insertional torque value, right? And ISQ. You know, resonance frequency analysis is all the rage, right? I mean, like, you know, the guys over at Austel for years, you know, they were like, yeah, we got this stuff and we've been researching since the 90s, right? On a stability quotient that we can use to quantify healing, right? And biology around implants. But then
so the question is, does it actually matter? Does it work? Because now there are new devices that we know about. They're less expensive. How are they working? Are they valid? And the real question that people want to know is, does torque matter? Does ISQ matter? How does that affect how implants should be designed?
How tight is too tight, John? Right,
exactly. Yeah. Exactly. And we're going to have some of literally the best minds in the world, and maybe the most controversial minds in the world.
How about this, John?
I think weigh in pretty strongly.
How about another discussion? How about a discussion about this idea of taking a tooth out, right? Okay. And putting an implant in a fresh extraction socket. I mean, immediate implant placement is the thing, right? That's where we're at today. We know that it's been published in some of the journals that we read, right, from the academy, that it is as successful as healed ridge surgery. But then what about, right, that gap, right, between the extraction site and the implant? Like, we're geeking out a little bit here. And what about this idea of partial extraction therapy?
Yep.
Right?
And there's a question of whether or not this partial extraction therapy, so-called socket shield, is actually here to stay? Is it something that you should be doing?
Exciting.
Is it something only for the 2 or 3 people in the world who can pull it off? And can we compare that to something that's more predictable, or is it more predictable? This is the stuff that everyone wants to know the answers to. And we're going to be bringing you, I promise, the top minds in the world on these topics who will hopefully weigh in strongly. One of the interesting things, we talked about this last night, is, you know, the journals that are the official journals of the Academy of Osseointegration are some of the best in the world. And that is, of course, iJomi and IJPRD. And we have been talking, we talked a little bit yesterday about some of the things that have been coming out of JOMI recently. We have been talking in the last couple of weeks, Wes, about who do we even feature on this show? There's so many speakers that are high level. But one of the ones that I think we want to just for a moment just mention, we're going to be talking to Dennis Tarnow. And everybody knows that name. We've had him on the show before. And there's some interesting new things that have come out. And he published a great article on attached gingiva and a new definition of that. And Wes, I think we get to that is the high weeds. But I may say that for this evening, we can come back to this. But this whole idea, which I thought was very interesting, the other article that we were talking about, the pros and cons of single practitioner versus interdisciplinary management for implant patients. Now, before we dive into this, I just will say this. As GPs, right, Wes and I we are interested in the role of how interdisciplinary management is affecting implant dentistry and its growth and its development and the responsibilities. We're going to be talking about the credentialing program that AO has to be able to show, you know, the true kind of knowledge base and some proof of what you should as an implant dentist. Dennis Tarnow talks about in this editorial some interesting things. You know, the idea that you should only treat the cases that you are capable of treating. The idea that not everybody maybe should be doing the same things, and we should maybe be referring certain things. We maybe should be letting our specialists do certain things. I think this is a great discussion. And I think that what he said here that I took home from this is you can only treat the things that you can diagnose. You can only diagnose the things that you know or see. And this is something we've learned from years of, you know, being tutored by Frank Spear and that group. You only treat what you see. And Wes, what did you it's interesting because Dr. Tarnow will be on the show. And although we're not directly interviewing him on this topic, I think it kind of hits at the crux of where we are, sort of a crossroads in who's going to be involved in implant dentistry. How does the team of the interdisciplinary team fit into this? And I think this was a very good editorial that kind of challenged us that every clinician should be honest with themselves about what their level is.
So I think, you know, the thing that I take home from this is he uses the word honesty a lot in this. In the middle of the article, in the heat, in the thick of this, he talks about that every clinician must be honest with themselves regarding what they know and what they can do clinically. And so, for instance, what that means is that you limit your treatment planning skills, one, on your knowledge. Now, that doesn't mean that you can't execute, right? If you don't know how to do it technically, but you have the knowledge of what's possible, right?
Right.
You can still be honest and have an outcome that is amazing. But the question is like, do you just try things, right? Because you don't.
Right.
And I think that's the thing here is, right, it takes what I've taken from this is it does take this discipline of implant dentistry. It does take everything sometimes to achieve the results that we need for some of these patients that have severe problems. And it takes a team of people to pull this off. You know, I'm in a practice, like John and I are, like we said, we're both restoring dentists and we're GPs, and we do have a surgical portion of our practice. Both of us have been doing that. But we have purposed in our practice that if we're going to practice to our current knowledge level, one, we're going to understand something so we can treatment plan it. But the second reason that I want to understand something is to know when I'm going to pull back, right? And say, you know what, I need to punt this portion, right? And here's what's great about the AO, John, is that the AO brings people of all minds together so that they can share knowledge. And so that
because the idea here is that everybody should be aiming to raise their level.
That's right.
Right? So you could find a general practitioner who is highly trained in doing very effective surgical restorative treatment. You could also find a specialist who hasn't gone to a serious continuing education course in 10 years and is still practicing the way they did in residency. And this goes all ways. So the idea with AO is to find everybody starts off with the same idea of coming and sharing knowledge and trying to elevate the level of every single practitioner. And when you do understand, I know for me, as I have understood more, there's been the more that I've said, okay, I need to make sure that I'm doing the things that I am the best at. And I need to make sure that the people that are doing the other side of it are doing the things they're best at. Now, if I can expand that, great. But if I can't, I need to know when it's time to have the team involved, which turns out is most of the time. And that's what AO was kind of founded on. And I think there's a role for every clinician in this team. It's a question of knowing, including the lab technicians.
Right.
Everybody needs to elevate their game, take it to the next level. That's what the Dental Guys has always been about. And when we talk to Dr. Tarnow, I think we're going to hear that from him. He is definitely one of those that will have no qualms about saying, hey, we need to do better. If we're working in the aesthetic zone, as he says here, it may be that the interdisciplinary approach is warranted. And it's case selection that matters. And so you look at, what's going on with what he'll be talking about with the research side, but then there's the philosophy side. And I think that's interesting to see what's going on in the actual business side of dentistry, which we'll have some business discussions. Putting it all together, the research, the data, the business, and then the ethics of this whole thing. What should we be doing? I think AO does that well by representing all aspects of the team at this meeting. And even again, the lab, because we got some high-level lab, like I said, I've said that before, high-level lab technicians. We've had them on the show before. They're going to be talking about what's newest and best there. They are elevating their game. If we have teams like this is how we're successful. And Wes, I think that's what I'm excited about.
So Dennis Tarnow,
that
has
elevate.
said, Dennis Tarnow has said that there's only one correct diagnosis, right? But there's many, many ways to treatment. And I think that, what we have in a lot of situations right now amongst young clinicians, new graduating clinicians, is we have this excitement, right, of what's possible. And you might be moving to an area where, hey, I don't have maybe the interdisciplinary support, maybe that in a mid-sized town might have, or even a city might have, or maybe you move to an area where you are, restricted on what's possible, right? But at least you could go read or go to an annual meeting like this and learn some knowledge about how to make the correct diagnosis, so then you can help your patient develop a treatment plan. People appreciate honesty when you talk to the patient. And I think that we owe it to ourselves as clinicians, as Dennis Tarnow says, to be honest with ourselves. And it comes down to case selection, as he says, case selection, case selection. He repeats himself 3 times. Yep. And ask yourself, he says this, what would you do, okay, if I were the patient, right? What would you do if it was you in the chair? Right.
And that's why we go to these meetings.
That's exactly right. So this article, John, it comes from one of the journals, right, that you can get as becoming a member of the Academy of Osseointegration. And this came out last year, and I remember reading it, and I was like, you know what, this is fantastic. November 4th of 2021, volume 41. So check it out. Quintessence is the publisher of the International Journal of Periodontics and Restorative Dentistry. This is a fantastic journal. It's a journal that John and I have subscribed to for a very long time, and I'm super excited that
So let's just a little glimpse as we kind of start to kind of close this out and get ready to shut our suitcases and get on the airplane in the morning. Can you imagine this, right? In the exhibit hall, there's going to be some chatter all around, right?
Yeah.
But there's some chatter. But you're going to hear these voices you're hearing now. You're going to hear those voices maybe a little louder than some of the other chatter. And you're probably going to hear the voices of some of these top name speakers and researchers as we're having a spirited discussion. That's the way I would put it. So we're going to be well placed in the exhibit hall to not only live stream and broadcast and record. It's going to be a little bit of a Sports Center feel, a little bit of a College Game Day feel. If you've seen those shows, you kind of know what we're talking about. And there's also going to be outward broadcasting of the live audio for the audience there. So it's a little bit participatory. You'll be able to see what's going on, hear what's going on, know what the controversies are about. I have a feeling we're going to have a hard time limiting our time with these guests, which I'm excited about. It's a great problem to have.
John, you're going to just have to take it down.
Simmer down.
Right?
I'm going to have to simmer down. Yeah, we're both going to have to simmer down, and we're not good at simmering down, but we'll try our best. And a lot of our speakers, I think they're going to be the ones that think, oh, I'll simmer. They won't simmer down. It's funny. So it's going to be a wonderful time, I think, of taking these speakers and getting, the next level from them. They're going to talk about some things. We're going to try to pull out the things you want to hear, the things you want to know, the reasons you come to the meeting. Remember to hit us up on our socials. That's the Facebook, the Instagram, the Twitter, especially to the AO hashtag. That is hashtag AO Dental Guys 22. That's where you can submit your questions, comments. Who do you want to hear from? What questions do you want us to ask them? Make sure you like, share, and subscribe both to the YouTube and Facebook of AO as well as the Dental Guys. Make sure that you tune in through the day. Coming up in the next little bit, hopefully in the next 24 or so hours, we'll have a schedule up of who we're going to be talking to. That's our goal. We got everything pretty much hammered out with that. Although there may be some special guests that come in along the way.
There's going to be special guests. You just know it's going to happen.
Yeah.
Yeah.
Exactly. So stay tuned. Make sure that you, like Wes said, have got your hand on your phone and have those notifications turned on so you know we're going live. We are ready for this. It has been a long time coming. So if you're about to head to San Diego, get a good night's sleep and have a safe travel there. And we will see you in San Diego. For Wes, I'm John, and we are the Dental Guys.